While anger is a normal and needed emotion, it can also become a psychological, physical, and social challenge. It's not officially a diagnosis in the DSM, but anger can certainly function like a behavioral habit or even a process addiction, making it a significant co-occurring issue for those in recovery from substance use disorders. Hey everyone, Dr. Joe here. Welcome back to my channel. For those new here, I create content, support, and resources for professionals and other high achievers who are looking to strategically address their substance use and their stress through effective science-backed tools. Today, we're diving into a powerful and often misunderstood emotion, anger. Let's talk about some of the common causes of anger problems. Depression, obsessive compulsive disorder, substance use disorders, attention deficit hyperactivity disorder, bipolar disorder, grief, unresolved trauma, family of origin issues. These factors can all contribute to heightened anger, making it difficult to manage emotions in a healthy way, especially for those in recovery. So recognizing the physical and emotional symptoms is key to managing anger. So here's what to look for. Physical symptoms might include increased blood pressure, increased heart rate, muscle tension, a tingling sensation. Emotional symptoms include irritability, frustration, anxiety, stress, rage, and feelings of being overwhelmed. Also guilt. So the way anger shows up, it doesn't always look the same. It could show up in a few different ways. The first would be outward. This is the classic anger most people think of. Shouting, cursing, breaking things, being abusive. Inward. Internalized anger is self-directed, often manifesting as negative self-talk, rumination, or even self-harm. Passive expressions include sarcasm, the silent treatment, passive-aggressive remarks. Physical responses. When people haven't been taught how to manage anger, they may pace, experience cravings, or have physical outbursts like yelling. Emotional responses. So without healthy anger management, things like guilt or sadness might be exaggerated. So triggers are related to anger, and signs that you might have a problem include, if you're wondering if you have a problem, you can look for if you find that you're frequently angry or irritated, if you feel like your anger is out of control, you regret things you've said or done when angry, small or petty things set you off. I also want to take some time to explore how anger can show up as a process addiction. When someone develops a habitual pattern of anger, they begin to experience it in a way in their body that triggers an attachment or a craving response. While anger may not feel traditionally pleasurable, it creates a powerful neurochemical reaction. Over time, people can start to crave that feeling of intensity. Just like with other addictions, the individual may begin to need more anger to reach the same emotional intensity. This functions similarly to the process of tolerance, where they require bigger, more or prolonged surge of anger to achieve the desired effect. You may see this play out when someone sets up scenarios designed to create conflict. Family members and friends might find themselves thinking, wait, how did we end up here? Because the person with the anger issue is unconsciously or consciously escalating the situation. If a conflict begins to cool down, the person might ramp it back up, raising their voice, yelling, stomping, or banging on walls or tables to reignite the feeling of anger. Their body and mind have become stuck in a cycle, craving the intensity of that emotion. So, what are some ways to deal with anger in recovery? The good news is that you can learn to manage anger effectively. So here are some strategies to get started. Pause. Breathe. Think before speaking. Take a deep breath to calm the brain and change the chemistry that keeps the anger patterns active. This allows you to think more clearly. Express your anger constructively. After pausing, use assertive communication to express your feelings in a healthy way. Change your thinking. Anger often involves rumination, going over the same issue repeatedly. Breaking this cycle can help you think more creatively and solve problems. Use I statements. Instead of focusing on others with you statements, use I statements to own your emotions. Let go of resentment. Holding on to resentment hurts you more than anyone else. Forgiveness allows you to break free from anger problems. Use humor. Humor can change your brain's patterns from anger to positivity, helping you stay on the road of recovery. So in conclusion and summary, for more content tools on how to manage stress, anger, and substance use, subscribe to the channel. Be sure to check out my link tree or description box for a link to a free workbook on managing stress to help stop drinking. Remember, learning to manage anger is not just about avoiding conflict. It's about creating a healthy and fulfilling life.